We'll start with the information. But first, an announcement.
So it's not allowed.
Oh, no.
I do have laryngitis. This is actually as good as my voice has been for the last 4 days. We'll see how long this lasts. Purpose of tonight's meeting, we'll be reviewing, just doing a very basic overview of the budget. I was going to do a little bit more, and then of course I got sick. And then I was thinking to myself, we've gone over a lot already this, over the last few weeks. I think you folks have more or less gotten the gist of the budget as far as the details go, so I'm not going to bore everybody by going back through every single department. We'll just look at the big issues. We'll take any questions or comments, of course, you have on the operating budget. And then at the very end, we'll review the draft warrant. So once again, let's just review the cost drivers in the proposed total budget. This is what we went over at the beginning of all this. We have our health insurance that's up 5.5%, workers' compensation that's up 13.1%, electricity is up 2%, heating fuels was put together by using our actual usage numbers by gallon multiplied by our current rates. Diesel and gasoline, again the same thing, using our actual usage numbers multiplied by our current rates. Current rates being what our rates were at the very end of December before the budgets went out to you folks. Our debt service has gone up by $112,000. That's due to the new debt of the highway garage and the fire station design. Cost of living assumptions that we made going into the budget was a 2% COLA, and the merit assumption is 2% as well. Those are based on the Northeast CPI from September of 2023, which is 3%, Social Security CPI, which is 3.2%. The local town's average adjustments were about 4.6%. You can see how the average COLAs and average merits broke down.
Those things add up to 5.6, though, don't they?
They do, and so we were kind of shooting for a target that was more or less in the middle. And then
No,
we
I'm
looked.
saying, you said local town average 4.6?
Yes.
And those two are 5.6?
Yes,
Is there
but
a discrepancy there?
there's a discrepancy because not every town uses COLA, not every town uses merit.
Oh, I
So
see.
when you average, when you take the whole thing together, it's 4.6.
Thank you.
And then for other references, we used the WTW salary budget planning and survey of U.S. employers, such as an average 2024 salary adjustment budgets, and Mercer's U.S. compensation planning survey and their average increases of 3.8%. So those are two different large-scale surveys that they have huge number of respondents. WTW has over 2,000 respondents. Mercier survey has over 900 respondents, but they have a larger focus on healthcare employers, which of course makes a lot of sense given the large number of healthcare-related professionals that we have on staff. And of course, another big change is the ambulance service being moved into the operating budget. As we discussed, our transfer program, which started as a pilot program in 2011, was always secondary as far as our operations to our 911 service. However, the revenues from that transfer program have always subsidized the cost of the actual ambulance operations as a whole. However, we've had difficulties maintaining staffing at a level that would be necessary to operate the transfer program since 2020. Transfer program has always operated with the excess capacity that we had in our staff due to the large number of part-time EMTs and paramedics that we had. Those people, unfortunately, are no longer available. Many have retired out of the industry altogether due to COVID and the many challenges that came along with that. Many folks have simply just left emergency medicine and gone into other areas of healthcare, such as, urgent care clinics, gone into nursing, what have you. And so all of that forced us into a position where we simply didn't have enough staff to run the transfer service, and so we suspended that service in June 2023. Other challenges that are facing the ambulance service include, of course, the ongoing perennial declining insurance reimbursements. Again, insurance companies pay, we charge them the cost of the service, they pay what they choose to reimburse us at. We do attempt to balance bill patients whenever possible. It's not always possible. There's also been an increase in 911 call volume, which reimburses at a lower rate than the transfers ever did. And then there's a number of legislative efforts that are creating even more uncertainty in the world. Last year in 2023 was HB 373. This year in 2024, there are 3 bills. Most significant of them is SB 407, which though would require insurance companies to pay ambulance services directly. It would be at negotiated rates or at the rate determined reasonable by the New Hampshire Department of Insurance, based on who knows what, at a rate of we have absolutely no idea. So there's a lot of issues, a lot of unknowns in the legislative world as well. Yeah. So we've responded to that uncertainty by suspending the ambulance service CIP until FY 2026. As you may recall, Deputy Chief Fahey and Chief Walker both talked at some length during that meeting when you saw the ambulance service budget and the fire department budget about trying to get the ambulances that we do have refurbished and finding other cost-cutting measures, at least short-term, while we relook at the whole program. The revenue shortfall has been distributed across all the towns that we serve, including Peterborough. And we've moved the ambulance service expenditures and revenues into the general fund, which will allow us to draw from other parts of the budget if there is a dramatic loss of revenue. Excuse me. However, we've left the ambulance CIP in the ambulance revolving fund. It is, of course, zeroed out at the moment, but in the future, should it come back, that is where it will live. Yes.
On the revenue side, it still showed, or it does show or project a $200,000 revenue for the new year for transfer services.
Yes, we are actively trying to get transfers back up and going again. I don't know if either of you want to jump in on that.
We still do some transfers. I mean, we're doing, I guess, the way to look at this, we still do what we refer to as emergent transfers. So, God forbid, somebody goes to Mid-Atlantic Community Hospital, presents with a heart attack, we'll transfer them out, brain bleeds, immediate need for surgery, stuff like that. We're doing those transfers. We're probably doing a rate of 2 a month. Is that reasonable? Maybe every other week?
Give or take.
Give or take 2 or so a month, so 24 or so of those a year. We anticipate, we are onboarding more people now, and as we mentioned, a lot of that, the driver for us suspending the routine transfers and the non-emergent transfers was a lack of staffing. We're hoping to see a little bit of relief in staffing. We're onboarding a number of new employees now, and hopefully that will work out for us to our advantage.
Thank you.
Any more questions about ambulance service before we move on? All right, one other change, this we did not talk about last week. We had been talking about this internally for a couple months now. Chief Menard has proposed a reorganization of the police department's leadership, which the select board has agreed to. Instead of a new full-time captain position, instead we'll be recreating 2 lieutenant positions. We used to have lieutenants. Those they went away at a certain point. We'll be recreating lieutenants' positions, which by utilizing existing staff. We'd be redistributing administrative duties, thereby decentralizing leadership in the department, which is currently just on the chief and part-time captain, and spreading that out so that the lieutenants are included. This is in my mind, not just a good plan for right now while we're entering into the transition phase, but a good plan going forward because essentially the more people you have involved in administration, the stronger, the more resilient the organization will be should something happen. You never can know. I mean, we like to use the Powerball example rather than the hit by the bus example, but someone could very easily win $1 billion Powerball and go and buy Bali, and that'll be that. So this would give us a bit of a backup, spread out some of the responsibilities. Also really allows for instance, right now we have 1 prosecutor. We don't have anyone else other than the chief who is able to take on prosecutorial duties. In the absence of the prosecutor is unable to take vacation because of the court schedule. So it would be really great to be able to get somebody in on a regular basis who can keep up on cases and allow the prosecutor to take a vacation from time to time.
So this utilizes current staff,
Current staff, yes.
and when it says there's a saving, that's
Will be a-
compared to what?
As compared to what we had originally presented to you for the police department's budget. So it would be a saving of about $80,000, spread mostly out of salaries, but also payroll taxes, retirement, and those other really big categories.
What percentage of that budget would that accommodate? Be under 1%, but
Yes.
I'm all for saving money.
And have we identified those two lieutenant positions already? Do we have two strong candidates, or?
There are a number of good internal candidates.
So will you be like, posting those positions, or how will that work? Do you have a procedure in place yet?
We haven't exactly determined the nuts and bolts of how it'll happen, but more than likely it'll be an internal process, an internal interview process.
But this change has happened since last Tuesday night, right?
This change is being made public since last Tuesday night. So this is the change that's going into the budget. Yes, ma'am.
What is the impact of the two new lieutenant positions? How is the timing related to the chief's planned retirement?
This is coinciding with essentially the beginning of a transition plan. Yes. So the idea would be that they would, the two new lieutenants would start taking on some of those duties and responsibilities from the chief and the captain, so that when those two gentlemen retire, there will be no missteps. Hopefully, if we're not able to draw the next chief from within the department, for whatever reason, lack of interest or what have you, we'll still have a strong enough administrative staff to support a new chief coming in from the outside who doesn't know the organization, doesn't know the community as well.
Any other questions about that?
All right, so then here's the review of the total proposed budget. We have the general fund, which is funded by a combination of fees, taxation, and now insurance and other municipal billing. The expenditures of $14,913,882 will be offset by estimated revenues of $5,589,298, with a net to raise and appropriate of $9,324,594. Everything else you see below there is not really what we're discussing here, but we have reviewed them. We've got the enterprise funds, which of course offset themselves with their fees, as well as the rec revolving fund, and the pay station, and the pay-as-you-throw fund, which we did discuss last week.
We discussed changing that number for pay-as-you-throw, right, last time.
We discussed changing the cost of the cost of the fees, yes.
Right.
And that's something that will not go into effect until after the selectmen have held a public hearing
Oh, that's right.
to do a code book amendment. So this is what as things currently stand, that's what we're going to be putting on the warrant.
And plus, you've reestablished the advisory committee,
Yes,
and that they will have input into that as well?
I believe so, if they would like to, yes. But it's really, they advise, the selectmen decide at the end of the day. Right. And just here's another, it's a chart that Al had asked that Lily and Carl worked together to put together. And you can see that we have all expenditures year over year. This includes the budget and the warrant articles from fiscal year 21, 22, and 23 are the actual amounts that were spent. Fiscal year 24, our current year budget, is the approved amounts, and in fiscal year 25, the proposed. And you can see it's the same data, but it's looking at two different ways. The first on the left is the expenditures by percentage in the different categories. Starting from the top, you have bond payments, next down warrant articles. Then you have all other budget items, the insurance for employees, Social Security and New Hampshire retirement system contributions, and salaries, including overtime. So So you can see how those have fluctuated over time. And then those same categories, but as expenditures by dollars in those same years. I know it's a little hard to see on the screen. Happy to share this with anybody.
That's a really good chart. I'd like to get a copy of that.
Absolutely. Share those. You know, the bottom of it all, of course, you know, your government is really made up by staff. Without staff, you don't have a town government. So that is your biggest cost center, is the staff. So with that, before I move on to the draft warrant articles, are there any questions on the operating budget? Any requests that you might have for more information? Okay.
Sounds like we're all set for now, thank you.
So here's the draft warrant articles. Here's the budget for fiscal year '25, $14.9 million. Changing the numbers, the same language as prior year. Next, we have the pay as you throw special revenue fund. As of this moment, these again are all draft articles. These are not the finals. I meant to bring in copies of the warrant for everyone. Sorry, this is going to get a little harder to read as we go. Article 5 is the capital reserve and expendable trust funds. I put all of them together into a single article this year. These are all of the previously established capital reserve and expendable trust funds, and the full amount to fund them all based on this year's CIP plan is $1.7 million. You can see how it's all broken out. Does include some offsetting revenue, which we've gone over before. Yes.
Does this mean, since the roadway systems upgrade is included in this, that Seth won't be presenting his whole roadway
That's our meeting.
presentation? Yes.
Not unless you would like him to. You can certainly incorporate that into the conversation about this particular article.
I think people know enough about it by now.
How many times have we reviewed, has he given that speech?
7 or 8 times.
Yeah, I've been there.
I think we all feel pretty good about it. I mean, it's, you know, if it was at all contentious, then I would have kept it as a separate article, but it is always done very well on the ballot. So I haven't seen a reason not to just include it in a comprehensive article.
It's like a tradition at this point.
I know, it kind of is.
Be great if it ends, though.
The view actually is better over here.
And that last bullet point, 500,000, but then it says 435,000.
Oh, I forgot to, I took out
There's
the.
a whole bunch of them are off.
Yeah.
Yeah, they may well be. So I was putting this together last week when I was still running a little bit of a fever. I haven't gone back to review it since then. So I had taken out the revenue, but forgot to adjust the dollar amount there. Numbers should be more or less correct, though.
Which is right, the numbers are.
And the bridges, neither is correct.
Oh, is
The
it?
dollar amount is
And the fleet
434,210.
Fleet management is
Okay,
correct as
it was a
well.
very high fever.
It was.
Yeah, off by $1,000.
Yeah.
So is it the written number or the?
Neither of them are quite
Okay.
correct. Again,
Okay.
draft warrant.
What is the full number correct?
And the fleet management
That's
is
what-
500,000.
Oh, that's weird, so I copied it into the wrong one. That's what happened there. Okay, I see what I did.
But the 1.7 million is correct, that top line number?
I don't know if it should be
I don't know.
all on the same
Oh, okay.
warrant, because then if somebody disagrees with one, then they can vote, then they vote against all of them. You know what I'm saying?
Yep.
I'm not,
One last year?
What's that?
It was one last year.
Well, the roadway was separated.
Roadway was separate, and bridges, culverts, and dams was separate because we were establishing
Brand
that
new,
fund.
yeah.
That's what I did there. I copied and pasted into the wrong one. Oh, well.
It would seem that people would be supportive of those two especially. If they drive anywhere in town.
Those are the big ones, so maybe not so much.
plus it's year 7 of the 10-year program, so.
If you would like me to separate them out, I'm
The
happy
top number
to.
is correct.
Really.
742,710.
It's really just a matter of consolidating the ballot, which is the only reason.
The this will be a ballot, not open session, right?
Correct.
Yeah.
There's an advantage to separating them in that the roadway was pretty defensible. I don't think we have an issue, but when you add everything together, it gets to be a big number, and the people who are just looking at the number and don't understand what all this is might be loath to vote for it.
However the board wants to do it, I'm happy to slow down.
I tend to agree. Separate them.
Or
One more
maybe
separate.
just, have the smaller ones grouped as one and maybe a couple of the bigger ones grouped.
Right, I think it would still pass either way, but it's a little risky to put a big number out there.
So bundle bridges, culverts, and roadway system, and then bundle the others?
Something like that, I think would be effective.
Bundle police, fire?
What about fleet management? I mean, is there a dollar threshold, you think, above which they should be separate articles?
I don't think it should necessarily be something that we strategically did. I think that they should be separate.
You want all of them separate?
I think that they should be separate. That's what I think.
You think you should have 9 separate articles right now?
Really? I do.
I don't think it takes that much for the voter to get through that.
Yeah. All right.
Okay, I'll separate them out.
If they want to do the math and come up with a total, that's up to them.
All right, Article 6, this will establish the West Peterborough TIF District Expendable Trust Fund. So we talked about this a little bit before, but the idea behind this, and I have one for every TIF district, is to set up expendable trust funds with the selectmen as agents to expend. So we'll take the money out of the existing escrow accounts and just sweep it into the expendable trust funds every year. And that way, rather than running the TIF projects through the budget, which causes, these big spikes and valleys, whenever you have a $300 million project. In this way, it keeps the operating budget really just the operating and puts the special projects elsewhere where it's a bit more transparent.
Does this need a little bit further explanation in terms of the fact that the West Peterborough TIF is sunsetting in?
I don't think it's necessary, but, as far as the establishment of it, but we can certainly discuss that at deliberative session. We can talk about when each
Yeah,
of
that
these
might
will
be the
expire.
appropriate place. The reason for establishing this, it's not clear. I know what the reason for it, but. Right.
There's the one for West Peterborough, then there's one for Greater Downtown TIF District. And then here's one for the South Peterborough TIF District.
Could you bundle all 3 of those together? Is that
Cannot.
possible?
No, they have to, if you're establishing new funds, you have to do them separately.
So we're up to Article 17 now. We're separating out all the others.
So, yeah, it sounds about right. And then this is incredibly rough language for the fire station bond. I have a phone call with our bond counsel on Thursday morning to go over this language. It's more than likely this will end up being 2 different warrant articles by the time I'm done with that phone call with her. But what I'm trying to do with this is to take the gross amount of the bond, which is not going to be exactly $12,100,000. It's just what I put in as a placeholder for the purpose of being able to write the thing. And then take what we expect to be the balance of the already approved warrant article from town meeting 2022 and put those proceeds against the project. That way, we're just able to continue using that money, spending it down. And then again, selectmen are authorized to issue the bonds, negotiate them, et cetera, accept any grants, any gifts, anything, any other revenue that comes in. This is a kind of a big, all-encompassing project warrant article.
What was the total amount from 2022? Was it 2 million?
It was $2 million, which included $700,000 of ARPA funds.
So to get us to where we are, it was 1.540? Am I doing that right?
About that, yeah. It's about that. It's that, again, that's a conservative number. We may have a little bit more than that once we get all the final bills in, which we should have better estimates on in about a month.
Didn't we decide that we weren't gonna use the term municipal campus quite a while ago?
I used municipal campus because that's what the title of the original warrant article was, so I didn't want to change it. And just keep it consistent from year to year. And seeing how the driveways and the public parking areas that will be part of this construction will serve more than just the one facility, it still really is a municipal campus. Any other questions on this one? And then this is my last slide. These are just the remaining meetings that we have on our schedule. Right now, March 5th is the public hearing schedule, or public hearing date. April 2nd, deliberative session, May 14th, ballot session, May 15th will be the open session.
Can you go back to that fire department one?
Sure.
It's 12 point, you might have explained this and I might have missed it,
Mhm.
but it's 12.1 minus 460,000
Mhm.
is no more than 10,600,000.
Placeholder numbers.
It's, again, yeah, exactly, they're placeholder numbers. So I don't even have the digits in there. It's really going to depend on what the final balance is after all of the
Right.
bills come in.
Well, I'm just saying 12.1 minus 460
No, isn't it?
10,600,000.
I know it isn't. I get it. And that's because I had a different number there in the first place. So I had just updated that number. Because originally it was 440. Any other questions?
Can we go back to the dates, so I'd like to
Either
put
way.
a calendar?
Make sure, I'll have 10 sets of eyes looking at it before it actually goes to the signature. So.
It's been a busy March.
Did you say what the residual in the West Peterborough TIF is?
I have an exact number. Lily, do you know what it is off the top of your head? In the escrow?
It's a couple million.
No.
Honestly, I don't know because I haven't moved the,
You haven't moved everything yet?
yeah, I just started moving money and got authorization for the expenditures today, so
That's right.
I don't know.
That much.
And it is considered complete, whatever was set out to be done?
Yes, but I mean, I can go get that figure right now.
No, it's fine.
You sure?
Yeah, well, I mean, we're gonna need to recalculate it anyways
Yeah.
after you've done everything.
Because we're still collecting monies through taxation that get put into that fund as well currently.
We're gonna have to have an estimate for the warrant anyway, so you'll have one definite, you'll have a number that we're gonna have on the warrant when we go to the budget and bond hearing.
And the intention is to take whatever that is and
Move it into this, yes, an expendable trust fund, yeah. And then we'll be doing that every year for the TIF districts going forward. So we'll take whatever is collected and sitting in the escrow. After expenses, we'll move whatever is the balances into the expendable trust funds
until it's played out.
until they're all played out.
Does this one warrant article handle that, or does it have to happen every year?
It'll happen every year. It'll be an annual sweep.
Is there any way to write it so that we don't have to do it once?
Unfortunately, it's town meeting is the only body that can move money into expendable trust funds. As far as I'm aware anyways.
When's it supposed to sunset? 27?
25.
Is it
West
20?
Peterborough TIF sunsets in 25.
Right. Greater downtown, not till 30-something.
6, I think.
Anyway,
Yeah. And then South Peterborough.
that's when they stop collecting that difference. But then there's the trust fund money to maintain the district as part of the budget.
You go back to that calendar now.
Yeah.
Is this
I
our-
didn't get finished putting it in my
There you go.
calendar.
Is this our last budget meeting, Tuesdays until the 5th for
This-
public hearing?
this-
And then, do we have a select board meeting next Tuesday, the 20th?
We can. currently have anything on your agenda.
Not if we don't need to. Well, how many times I've said that?
I do not currently
No
have...
meetings for the sake of having meetings.
I do not have anything for you to discuss next Tuesday, so.
But our next meeting is on the 20th.
Currently scheduled, but we can cancel it.
It's, well, you have a budget bond hearing.
That's just for me to put it into the paper.
Oh.
That's a reminder more for me than anything.
Oh, okay, so there's no meeting associated with those?
No.
And then on the 5th, that would start at 5:30 also, or? what?
If you like, whatever time you'd like to start it.
And won't that be the first Tuesday of March?
I believe so.
The
I believe so, yeah.
So we have a select board meeting anyway. If there's nothing to read about, then we won't, but
Gonna be the first Tuesday in March, only the 5th.
Exactly. Can double check that too.
all right.
So would you like our budget committee to voice their approval or disapproval of the budget tonight, or is that
I
not?
would not be opposed to that. It's not necessary, but I certainly would appreciate a straw poll or a, general short support.
I know at some point we voted.
You will have to vote on the 5th.
On the 5th, is that
yes.
when the official vote is?
So we still have time to come up with amazing ideas to save millions of dollars in between now and then.
Well, I've got a couple.
And fine tune the figures.
So noted.
Does anybody on the budget committee voice strong disapproval or even moderate disapproval of the budget as presented so far?
So I'll be voting against it.
Of course you will.
There's a headline for you, Jessica.
Okay.
Yeah, write that down.
What is your issue?
There seems to be $450,000 missing from revenue in the maintenance department, and I've gotten several emails out, haven't seen a response that makes any sense. And it doesn't seem appropriate to vote for a budget if there's $450,000 that's going missing.
As what? Revenue?
So in.
Just say which department again?
Ambulance.
Would that be the warrant article from last year, was that?
That was my thought.
Not added to this year's budget?
There's been a lengthy back and forth between Mr. Osterman and members of the Fire Rescue Department, Dennis Allen from Medical Billing, and now today the entire Budget Committee as well on this topic.
So missing implies it's there, but it's missing. What do you mean by
So during the
missing?
chief's presentation, he said that we were collecting 65% of our billed charges. The documentation provided by EMAX and the chief shows the number's actually about 40%. The 40% is very low. It's about 50% less than the 65% he reported, which is also what other ambulance companies tend to collect. If we were collecting the same amount of revenue off of our charged services that we deliver as other towns in the area, we'd be getting an extra $450,000 in revenue. I haven't seen a clear explanation for why that isn't happening.
The explanation was pretty clear, as Dennis explained when he sent out those figures. You requested gross numbers, and he sent you gross, and he also explained that you can't use these as comparisons because you have to net out the amounts that you are actually able to bill to Medicaid and Medicare first. You were looking at gross amounts charged by line, charged by a type, which is what he sent you. The problem is that you can't charge the full amounts of those types to Medicaid and Medicare.
Well,
So
you can't do it to Medicare, you can't do it to Medicaid. But the issue with that explanation is if that's true, it means there's a secondary revenue stream for the incremental revenues that we
Not
would be
necessarily.
collection. And that's not showing up in the budget either.
There isn't necessarily a second revenue stream. Medicaid patients have no money, that's why they qualify for Medicaid. And so if you try to balance bill them, they will
But
say,
you
I can't
but
afford
you-
it.
you cannot-
Which you cannot do.
You
It's
cannot
not-
do that. My point is the same problem persists for commercial payers, Blue Cross Blue Shield payers, as well as self-payers that have no insurance.
Blue Cross Blue Shield pays what they choose to pay, as do other commercial payers. They don't necessarily pay the full amount that is billed They will sometimes pay more than Medicaid, Medicare, but not always. Generally, they only pay at that rate. We do try to balance bill their patients. Sometimes they will be able to pay, sometimes they will not be able to pay. So you
You're
have
still
to
under
net
collect-
out.
No, you're still under collecting on patients that have no insurance at all.
You should let the town administrator finish your sentences
Well,
before.
we've already done the back and forth on this.
Oh, well, then I guess we don't need to do it now.
Sure.
So there is no missing, there's no missing funds. When you actually net out the, the billing. Take out all the things that you first can't legally charge for, and then take out what cannot be received, what is uncollectible for various reasons, whether it's because Anthem Blue Cross and Blue Shield says, no, we don't feel like paying that much, or the patient themselves can't afford it, and so they financially qualify for forgiveness. At the end, you collect about 65%. You're able to bill. And
Makes sense to me.
that is,
But that's
and
not
I will
what
say that
those
we used to have
reports show.
Comstar ambulance service, which I know you have advocated that the select board consider terminating the contract with EMAX and
I
going
have
with.
not suggested that at
And
all.
actually, you
I've
did. Let
suggested
me
we
pull up that
review-
email.
I've suggested that we reach out to other ambulance services that are able to collect 65% on the dollar with the same patient mix that we have
Mhm.
and are therefore overperforming our department.
I don't believe
And
that
for
that is.
some reason, we are opposed to talking to other vendors, even though those other vendors could be generating substantially more revenue for
have-
the town.
We have had those other vendors, and I will tell you that even now, we are collecting more than what we are collecting when we had those other vendors collecting for us on behalf of the Peterborough Fire Rescue Service. EMAX is doing a great job. They are incredibly responsive, as you know from your own experience. I doubt that you would have gotten an email response even to your first email inquiry to a Comstar or any of these other ambulance
But the
services.
answers provided don't add up.
They do add. They add up when you actually look at the entire picture. You are cherry picking out of gross data. Unfortunately, that's not going to give you an entire picture. When you actually look at the whole thing, what you get is a very clear picture that's reflective of the ambulance services in general. We bill out, we do not collect everything that gets billed out.
No, you
And
collect
we-
40% of what gets billed.
If you look at gross numbers, yes. If you look at gross billing numbers, that is not uncommon. You're not talking, when you look at, you're actually able to collect from the get-go, 65%. That's reasonable. It's reasonable in this industry right now, unfortunately.
So we're able to collect 65%, but we're only collecting 40%.
I think we've gone back and
I
forth.
mean, I'm
out
happy to
there.
keep going about this. I thought you wanted to move on.
No.
I think, yeah. those-
Lily, do you see $450,000 missing from revenue?
No.
Thanks.
So, yeah, so the word missing was disingenuous.
Very.
No,
Okay.
it's a comparison
Let's put
of
that in
the
the paper.
numbers that the chief gave and the numbers that are present in the budget.
I'd like to propose that Andrew, I mean, this is a very serious charge he's making. I'd like to see it written out in a clear fashion that we can all see it and get a rebuttal from whoever in the town administration is appropriate.
Sure.
For clarification, is it a lost opportunity or money that was collected that we are not reporting?
Well, that's the interesting question. I think it's a lost opportunity.
Okay, so a
Hold on,
lost
hold on,
opportunity is
hold on,
not,
hold on.
I need to clarify my question. See, unlike you, I would like to specify the exact question I want answered. I am curious,
Yes.
a lost opportunity is not missing money. A lost opportunity is money we could be receiving that we are not currently receiving.
I don't,
Are you saying that we could receive more money, or are you saying that we are receiving money we are not appropriately accounting for? Because that's what lost revenue is.
well, I think that's debatable and it's semantics. Like, I think.
Oh,
and
no,
it-
I think it's pretty clear what Gene was saying. Yeah,
But
so
here's
I-
the issue, is that the explanation for the discrepancies changes. So if it's 65%, that means we are collecting more revenue than is showing up in the budget, in which case it is missing. Now, I don't think that's what's going on. I think it's a missed opportunity to collect $450,000. But the explanations I've been given about why this is happening point to it being a missed opportunity in terms of dollars that are being So I don't think somebody has taken it out of the pocket, but all the explanations provided suggest that that is what's happening. So no, like, I don't have clarity on this. This does not make sense, and so I will be voting no.
For those of
I
us,
think Carl's got a good point.
yeah, for those of us who don't know all of the background discussions, this is incomprehensible. We can't really tell what's going on here. So if you could write down in a fashion that includes all the relevant information, then we can all look at it and see if there's something we want to say further.
Right, we can continue this discussion maybe on March 5th.
Sure.
Based on that, and if the town administration.
But it's going to have to be a complete statement so that we don't say, but there's something that happened I left out. It has to be a complete statement. Okay.
Sounds like the explanation seems pretty simple.
No.
You're collecting 65% of what you're allowed to bill.
But that's not
Is that
what
the
she,
explanation?
that's just not what she just said. She said we're only allowed to collect 65%.
No, she didn't say, that's not what she said.
I mean, I think Carl's idea, I think it makes much more sense to write it out.
You can drag it all you want.
Made perfect sense to me.
I mean, it's $500,000 on an ambulance service that's losing close to $1 million a year. To put it in context, our ambulance service is going to lose more money this year than it costs to run the entire Milford ambulance
I'm
service.
sorry,
Despite the fact that they provide a higher level of care.
you're operating from a false premise. This isn't losing money. This is not a profit-earning organization.
Yes, the
We're
delta is
providing-
$1.3 million.
This
It's
is-
definitely not making a profit.
It's not trying to make a profit. This is providing a public service. You don't make profits on highway departments. I don't see you attacking that. You don't make profits on police departments. I don't see you attacking police service. Why are you going after another public service?
Because we lose $1.3 million on an ambulance service, which other towns are able to provide a comparable, if not superior level of service, while only losing $200,000. So that's a $1.1 million spread.
Is
What
it, what other town provides transfer?
Is the
And
word
it equates to
spend better
10%
than
of the
lose?
budget.
Would spend be a better word than lose? In other words, the town of Peterborough is spending that money to provide a paramedic level ambulance service, where another community may be spending 200,000 net, because again, it's about net.
If that term is more appropriate.
Well, because it is, because it does relate to a different conversation which we've had, which I know is something that you have, that you've questioned, not you, but other people have questioned, not just you, is the level of service and the cost of providing a paramedic level service versus AMT versus BLS versus one ambulance versus two. So we have the cost that we spend based on the service the select board have determined the community needs. And then we have an opportunity to capture revenue through billing ambulance patients and billing other communities to receive our service. That delta is the cost to deliver that service. Your statement is our cost is higher than some other communities for what you believe is a comparable service. Is that a fair summary? Is that that's what I heard you say?
Our costs are higher, but what's odd is our revenue is significantly less. So if we're going to be providing more services, we would think that the revenue would be higher as well. But the spread between what we pay and what we receive is out
So
of...
what our operating budget is, that's what we pay. That's what your reference to pay.
Sure.
Okay.
The spread between our operating budget and the operating budgets of other towns is significantly higher.
Yep.
And the spread between the revenue that service generates and the revenue the same service generates in other towns is significantly lower. If they were both higher, it'd be one story. If they were both lower, it'd be a different story. But we are moving up in costs and we're moving down in revenue.
All right, so what you're looking for is I'm trying to clarify this for you so I can come up with answers. You're looking for a better explanation as to correlation between the cost of delivering service and the ability to capture revenue through reimbursement or billing other communities.
I'm very focused on the bills that are going out the door and how much dollars we collect on them.
Okay,
And that's the percent that I'm struggling with.
okay.
And that number, according to the reports that Dennis did provide, suggests it's 40%.
Are you looking for total reimbursement, which includes the money paid by an insurance company, primary insurance, secondary insurance, and individuals?
Total charges versus total revenue, yes.
And are you looking for, because again, I'm trying to clarify this, because going back to Nicole's discussion about gross. Are you looking for the difference in the gross amount billed or the legally capturable amount billed, because those are two significantly different numbers, and that's where I think some of our miscommunication is happening.
Why don't we, excuse me, why don't we just wait until you can
Okay.
do that in writing? 'Cause I think-
Sorry, Rick.
No, I think it's great that you guys are kind of trying to clarify what we're looking
Yeah.
for, but I think until, Andrew can put that in writing, and
I think-
then you guys will have a chance to look at it exactly and analyze it, and then we can take it from there.
I think we're going to need deadlines because March 5th is coming up very quickly. So we're going to need time to be able to respond to whatever is put in writing. So we'll need a deadline to receive that request or that report, as Carl put it, and then an opportunity to respond before the 5th. Because I would like to make sure that the Budget Committee has that on the 29th, which is the Thursday before the public
It's
hearing.
not a problem.
So that means that we need a chance to see it, so you'll need to get something to us with time for us to do research.
So when would you like Andrew to get that to you, the latest date?
We get it by Monday,
Tuesday.
yeah, 19th.
So we already know what you want, so what's stopping you from emailing that tomorrow?
Well, apparently, I need to be very careful on how I choose my words.
Oh, it is.
Well, so does everybody else.
So let's see, so try to get that in by next Monday, is that fair? And then that'll give them time?
19th, okay.
Now, I think we're not looking here just for a question of what he wants in the way of information. I think he wants an explanation for what he sees as a problem.
Right.
Right.
So
Yeah.
I'd like to see why he thinks there's a problem, and then we can see what to do with that.
Excellent, okay. Well, generally speaking, I'm glad that the Budget Committee is happy with the budget as you framed it so far, and we look forward to the March 5th or final, and hopefully some of this back and forth on the ambulance can be resolved by then, so everybody will be happy. Anything else we have to discuss this evening?
Minutes?
Do we have any minutes to approve from last time around?
Are there any adjustments that you need to make to the budget at this point?
I made them last week, and that what you were sent out by Ally is the adjusted budget. So the $80,303 reduction in the police department salary budget
That's
has been
adjusted.
made. And so what you're looking at, what you received last Thursday, is the
It was in the
budget with
packet.
adjustments.
Okay.
Mhm.
I'm going to update my street here as well.
Are there any questions about the minutes that Ally sent out? Any significant alterations?
Thought they were great, I would move acceptance.
Anyone want to second that?
I'll second.
All in favor, say aye.
Aye.
Opposed? Unanimous. So, without further ado, then maybe we're adjourned for this evening? Thank you, everybody.
Yes.